Module 6, Lesson 2, Referrals. In this module, we'll have two sections: condition for referral and referral process. Let's start with section 1, conditions for referral. Some of the conditions that one can refer when finds in the community are fevers. A patient complains of feeling cold or when their body is very hot. Supportive management for fevers are removing excessive clothing to help reduce body temperatures, tepid sponging, refer immediately, reduced body temperatures. Body temperatures under 35.5 Celsius are reduced. Supportive management for reduced temperatures are warm clothing, refer to healthy facility, lethargy, not easily arousable or significantly less active. Usually sleepy, tends to sleep for longer time than normal and is not easily woken up. Supportive management for lethargy is refer immediately to the health facility. We also have chest wall in drawing. In an infant has a chest wall in drawing if the lower chest wall goes in when infant breathes in. Chest in drawing occurs when the effort of the infant needs to breathe in much greater than normal. In normal breathing, the whole chest and wall, upper and lower, the abdomen move out when the infant breathes in. Breathe in. Supportive management for chest wall in drawing. Refer immediately to health facility. Difficulty in breathing. Hoarse voices are produced. Rapid breathing and rapid breathing. There is some wheezing. Coughing that sounds like seal barking. Sucking or chest curving in or retraction. Nasal flaring, nasal and chest congestion, blue skin, lips or nails. Supportive management. Refer immediately to the health facility. We also have fainting. This occurs due to reduced blood flow to the brain. It's usually temporary. Supportive management for fainting are ensure client is lying down and breathing. Elevate legs to help increase blood flow in the brain. Refer immediately. We also have seizures. Occurs when brain malfunctions, resulting in uncontrolled changes for movement, attention, or level of awareness. Epilepsy is not an infectious disease. It's not as a result of witchcraft. It is not as a result of unfaithful behavior by the mother. Stages of seizures are: we have confusion, distorted emotions, numbness, dizziness, and hallucinations. We also have stiff body, epileptic cry, incontinence, and back act. We also have jerky movements, frothy saliva, blinking eyes. We also have weak lips, exhaustion, and sleepy. Supportive management for seizures. During an attack, the patient should not be held down. The patient will sleep deeply after a fit. Don't disturb them. Remove the object that may harm the patient during the fit. Refer the patient to health facility immediately. We also have epilepsy. A seizure is a single occurrence. Epilepsy is a brain condition characterized by two or more unprovoked seizures. Signs of epilepsy. Epileptic fits occurs repeatedly. They should not be confused with fits or convulsions caused by high fever. A fever is causing fits or convulsions, there will be other symptoms, such as convulsions will disappear once fever is gone. Two main forms of epilepsy are severe fits, which is loss of consciousness or falling down, violent movement of arms and legs, saliva coming out of the mouth, biting the tongue, making strange noises, and sometimes passing urine and feces. We have mild fits, which are characterized by quick moment of feeling or looking blank. Eye may turn up, short period of unconsciousness, not falling down or other symptoms. No one knows it's happening, not even patients. Often, these mild fits are seen in children. Epilepsy can be treated. Supportive management are referred to see a doctor, may be able to give medicine to control the fits. Families should help epileptic patients feel as normal as possible. Mental health. Our emotional, physiological, and social well-being affects how we think and feel and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood, adolescent, through adulthood. Poor management mental health leads to mental health is significant determinant of overall health and socio-economic development. Unhealthy lifestyles, poor physical health, reduced ability to handle stress, and less productivity. Employment and earning challenges, poor relationships, prolonged recovery from illness, greater limitations in daily living, lower education attainment, less social cohesion and engagement, decreased quality of life. 1 in 4 Kenyans are likely to suffer from mental disorder at some point in their lives. Kenyans with mental health do not receive treatment. This is 5 in 6. The cost: 5 hours 36 minutes, number of productive hours lost per week for those who suffer from depression. Lost in productivity globally due to depression. What do people say cause mental illness? I'll consider a survey of over 2,000 people across the rural urban areas in Kenya. Perceived causes are substance use, witchcraft, brain damage due to the accident, and genetic. Causes: many factors contribute to mental health or mental health status, such as physical health, disability, biological. These are in biological. Drugs effects, temperament, peers, family circumstances, school. This comes to social. Family relationships and trauma also comes to social. We also have physiological. This is coping skills, social skills, and self-esteem. Common disorders of mental are 41% are depression, 15% is anxiety, and 11% is drug use disorders. 10% is alcohol use disorders, 7% is schizophrenia. Depression signs: sadness, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep or appetite, feelings of tiredness, poor concentration. Risk factors for depression are poverty, unemployment, life events such as death and of loved one or relationship breakup. Physical illness, alcohol and drug abuse. Although depression can and does affect people of all ages from all walks of life, the risk of becoming depressed is increased by depression is a single large contributor to global disability. Depression is ranked by World Health Organization as a single largest contributor to global disability. Depression is also the major contributor to suicide deaths, which number closest to 800 per year. The consequences of disorders in terms of lost health are huge. Depression is also a major contributor to suicide deaths. Depression significantly increases one's risk of suicide. 4 in 5 Kenyans who commit suicide are depressed at the time of their death. Regionally, East Africa has some of the highest rates. Men are 3 times more likely than women to commit suicide. Suicide is second leading cause of death among 15 to 29 years old. There are more deaths from suicide than from war and homicide together. 800,000 people die by suicide every year. 1 death every 40 seconds happens due to suicide. Vulnerable populations: women. Poverty, sexual violence, domestic violence, discrimination, and conflict has exposed them to high prevalence of certain mental disorders, such as depression and anxiety. African women have highest rate of depression of any population in the world. Postnatal women have 2 to 5 times more likely to be depressed. Children prone mental disorders either at birth, when there might have been inadequate prenatal care. If their environment does not promote care, affection, love, stimulation for cognitive abilities, or other emotional and social support. Children may be molested by relatives and strangers without speaking up. We have also adolescents. Peer pressure to risky behavior like drug and substance abuse, pressure of school, difficulty in talking to adults about stressors within the family. We also have elderly. Older persons, especially those without social protection and social networks, are often vulnerable to mental disorders. They are also vulnerable to rape, which mostly goes unreported. Vulnerable populations: people emerging from conflict and disasters. Traumatic stress experienced in an event like a major accident, war, assault, or natural disaster, where people may be damaged or being seriously hurt or killed. People who experience traumatic stress often experience temporary symptoms of mental illness, but most recover naturally soon after. There is no health without mental health. Mental health problems are common, but help is available. People with mental health problems can get better and may recover completely. Kenya's vision on mental health. A nation where mental health is valued, promoted, mental disorders prevented, and persons affected by mental disorders are treated without stigmatization and discrimination. The mental health training shall be integrated in training circular of all health workers, which shall include adequate content and time offered on mental health training. Early warning signs. Not sure if you know someone you know is living with mental health problems. Experiencing one or more of the following feelings or behaviors can be an early warning sign of a problem. Some of the early warning signs are eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, yelling or fighting with family and friends, feeling unusual, confused, forgetful or edged, angry, upset, worried, or scared, hearing voices or believing things that are not true, experiencing severe mood swings that cause problems in relationships, thinking of harming yourself or others, having persistent thoughts and memories you can't get out of your head, inability to perform daily tasks like childcare. What should you do if you come across someone you suspect has a trouble with their mental health? Have a mental health first aid action plan. When helping a person going through mental health crisis, it is important to look for signs of suicidal thoughts and behaviors, non-suicidal, self-injury, or other harm. Let's start with A. Assess for risk of suicidal or harm. Look for signs of suicide thoughts, suicidal behaviors, and self-harm. Explain to the caregiver the importance of replacing fluids in child with diarrhea. Listen non-judgmentally. It may seem simple, but the ability to listen and have meaningful conversation requires skill and patience. Listening is critical in helping an individual feel respected, accepted, and understood. Mental health first aid teaches you to use a set of verbal and nonverbal skills such as open body posture, comfortable eye contact, and other strategies to engage in appropriate conversation. Give assurance and information. It is important to recognize that mental illness and addiction are real, treatable illnesses for which people can do recover. When talking to someone you believe may be experiencing symptoms of mental illness, approach the conversation with respect and dignity. Do not blame the individual or his or her symptoms. Mental health first aid provides information and resources you can offer to someone to provide emotional support and practical help. Encourage appropriate professional help. There are many professionals who can offer help when people in crisis or may experiencing the signs and symptoms of mental illness or addiction. Types of professionals are doctors. These are the primary care physicians or psychiatrists. Individuals with mental illness can contribute to their own recovery and well through exercise, relaxation, and meditation, participating in peer support groups. Discussing mental health, like depression or suicide, does not increase someone's risk. When helping a person going through the mental health crisis, it is important to look for signs of suicidal thoughts and behaviors, non-suicidal, self-injury, and other harm. Action plans that connect those suffering with appropriate help can someone outcome. Myth: prevention and awareness does not work. It is impossible to prevent mental illness. That's one of the myths that we have around here. The facts that we have: prevention of mental health, emotion, and behavior disorders focuses on addressing known risk factors such as exposure to trauma that can affect the chances that children, youth, and young adults will develop mental health problems. Ways to build positive mental health fitness: cognitive with others, practicing gratitude, finding positive ways to look at things, getting physical active, helping others, getting enough sleep, developing coping skills, be kind towards yourself and others. Take time for rest. Exercise at least a few times a week. Participate in activities that you enjoy. Surround yourself with positive support network. Eat balanced diet. Educate yourself on mental health. Unmanaged stress can lead to poor mental health. Stress management techniques are: understand what stress is. Write down picture that life would be like if you are managing. Identify what's causing your stress now. Understand your response to the stressors. What will happen if you don't change? What will life be like if you don't change? If you do change, plan personal strategies and techniques to manage stress. Take action. If you keep doing what you always do, you'll keep getting what you always get. What are referrals? These are the act of sending person to link health facility for further management. Contact with the patient. You have to screen is completed and decision for referral is made. Filling the referral form. The data of patient, date of the referral, name of the patient, age, gender, and the name of the community unit. Reasons for referral, main problem, treatment given, comments. Data of the community health volunteer referring patient, name, mobile number, village or sublocation, name of the community unit should be indicated. Action taken by the officer or the community health volunteer should be there. The referral form used to refer the patient to the health facility. Very important in communicating necessary information. Of the patient of health professional who is going to see the patient. The health professionals also will notify you that they have seen the patient. The necessary follow-up which is expected is to be done by the community health volunteer. Timely referral reduces the risk of severe disease or death. Early referral ensures correct assessment and treatment. The health facility is scary. The people there will be interested in helping my child. These are some of the barriers that we get from the community. But we have to explain what will happen to the child in the health facility and write a referral note to help her get the care from the child as quickly as possible. Some of the barriers: I cannot leave home, I have other children to care for. The questions that one should ask the client is, ask question about who is available to help the family and locate someone who can help with the other children. We also have, I don't have means to get to the facility. Help to arrange transportation. In some communities, transport may be difficult. Might buy a motorbike. I know why my child is very sick. The nurse at the health facility will send my child to the hospital to die. Try to explain to the parent about what should be given as support in the hospital.